Welcome. My name is Meredith Toohey, and I'm the Director of Programmatic Operations at the American Nutrition Association, the ANA. The ANA is very pleased to be hosting Britt Reuter for a webinar titled Why is My Hair Falling Out? Stress and Inflammation as Root Causes. In this webinar, Britt will discuss a whole body and root cause approach to hair loss. Britt Reuter is a licensed dietitian nutritionist and a certified nutrition specialist. She graduated from the Master of Science in Human Nutrition program from the University of Bridgeport. It's Britt's personal experience with chronic inflammation, coupled with her formal training in nutrition and functional medicine, that empowers her to help women overcome the symptoms they feel stuck with so they can get back to living their best life. Welcome, Britt.
All right. Hi, everybody. I'm Britt Reuter, and today we're going to be talking about a whole body root cause approach to hair loss. So on the agenda today, we're going to go through just a quick introduction, and then I'm going to go into some stats and facts, lay out what a functional approach to hair loss can look like, and then talk a little bit about my functional hair loss types. So introduction, I'm Britt Reuter, and I'm a certified nutrition specialist. I'm also a supervisor for prospective CNSs. I'm a licensed dietitian nutritionist, and I have a Master's of Science in Human Nutrition from the University of Bridgeport. So let's dig into some stats and facts about hair loss. So more than 50% of women will experience noticeable hair loss in their lifetime. So that's a lot. And, men obviously experience hair loss as well, but for women, especially, it can be, really emotionally devastating, difficult symptom to experience. So my clinical focus is primarily working with women. 6.8 million people in the US and 147 million people globally are believed to be affected by alopecia areata, which is one type of hair loss, an autoimmune type. I wanted to spend a minute at the beginning. We know that there's a large prevalence of hair loss based on those stats that I just shared, but I want to take a minute to talk about the mental health impact of hair loss. People that experience hair loss can experience a decreased self-esteem, increased anxiety or depression. And I think it's really important to remember that as certified nutrition specialists, no matter what our, specialty is or scope of practice, that, we're ready to refer our clients or patients to mental health care providers, at early signs, be really ready to do that. So I'll just share a little bit of clinical experience here. So a lot of the clients that I work with experience increased anxiety on shampoo days that they're going to wash and style their hair, and experiencing mental distress or avoiding daily living activities like personal hygiene due to hair loss. That would be a really good example of when you would want to refer someone to a licensed mental health care provider. So let's talk about the hair life cycle phases. So there's 3 phases: anagen, catagen, and telogen. So the anagen phase is the growth phase of our hair. And the healthy hair follicle will stay in that anagen phase for about 2 to 5 years. And at any given point in time, 90% of my scalp hair, for example, right now is likely in that anagen phase. The catagen phase is called apoptosis-driven regression, and hair follicles are in that for about 3 to 6 weeks. It's really just like a transition between that growth phase and then this last phase, telogen, which is the inactive or rest phase of a hair follicle. So the hair will stay in that for about 3 to 5 months. It's 10% of our scalp hair is in that telogen phase. So here's some healthy hair stats that I think are important for us to know. So normal healthy hair shedding is at a rate of about 50 to 100 hairs per day. So greater than 100 hairs per day shed is considered excessive hair loss, excessive shedding. Our scalp has about 100,000 hairs on it. differs person to person, but that's a good estimate. And healthy hair can grow at a rate of about a ½ inch per month. So let's just spend a second on diagnosis here. So hair loss is diagnosed by a qualified healthcare practitioner. So sometimes the clients that I work with on our intake form, they might report that they've experienced, excessive shedding, but you always want to be careful, be mindful of your scope of practice and not overstep into diagnosing, and, make sure that you're practicing within your scope. So a dermatologist, for example, is able to diagnose hair loss and can examine, their patient's scalps and determine whether hair loss is scarring or non-scarring, whether it's permanent or reversible. And one other thing, though, is to not confuse diagnosis with root cause. So if you have a client that's presenting with androgenic alopecia, for example, that's an example of a diagnosis, but it doesn't necessarily reflect the root causes of what's driving their hair loss. And we'll kind of get into that a little bit more as we continue here, just differentiating between that diagnosis and that root cause. So hair loss versus hair shedding. So there is a difference between these two things. So hair loss is the technical term is anagen effluvium, and that's when the hair stops growing. Contrast that with hair shedding, that's telogen effluvium, and is considered excessive shedding. So from a medical perspective, those two things are not the same. But I often find that the clients that I work with will refer to hair loss or hair shedding as hair loss. And so typically what I do is just reflect back the language that the client is using. The client comes and is talking about hair loss, so I just in turn refer to hair loss. You don't really work with too many clients that would be that precise, but there is a difference there. So I wanted to highlight that. So hair regrowth, it's often something that clients will lead with. Obviously we understand that hair loss is very distressing to experience it, and clients want to find out if there is something that they can do, if there is a nutritional link to their hair loss, what can be done to reverse it. So I think that when it comes to hair regrowth, it's important to remember a couple of things. First of all, hair regrowth isn't possible for every person. And so it's important to be honest and realistic about what your goals should be when your client's working with you. I think it's smart also to track multiple symptoms, just because hair regrowth isn't possible in all cases. Really focusing a little bit more broadly, trying to encompass a wider classification of different symptoms that you want to track over time. For example, other signs or symptoms of hormone imbalance or gut health issues that you want to, help your client work towards achieving some goals in other areas as well, and not just zero in on one specific symptom. And kind of part of that too is also helping the client to define other sources of motivation, what their quality of life or sense of wellness would be if they were to achieve some of their other wellness goals, like having, more restful, rejuvenative sleep, to feel, less stress or anxiety, to have more energy, that sort of thing. So let's start talking about a functional approach to hair loss and what that can look like. So here's how I define a functional whole body approach to hair loss. First, it understands that although hair loss presents topically, the underlying issues can run much deeper. So I like to say to my clients that healthy hair growth starts on the inside, just to kind of help reinforce that idea. Something that I also like to emphasize when talking about hair loss is that as much as hair loss can seem like the core issue in and of itself, that it's actually just a symptom of something much deeper going on. A functional whole body approach also asks the question, what is interrupting the normal hair growth process? The reason that I phrase it that way is because our body doesn't see hair growth as an essential process. And so, if there is stress on the system, stress on the body, it's not uncommon to see the hair growth process interrupted. And so just kind of thinking a little bit more deeply about the symptom of hair loss there. A good reframe might be that, hair loss could be an adaptive response to an imbalance somewhere else in the body. And then lastly, a functional whole body approach to hair loss continues investigating abnormal labs to get to root cause issues. So just as an example, finding that a client's labs are reflecting iron deficiency, a functional whole body approach wouldn't be satisfied at that level. It would want to understand what is provoking that iron deficiency, or if a client's lab is reflecting underactive thyroid, or they've been given a diagnosis of hypothyroid and are also experiencing hair loss, a functional whole body approach would want to understand that hypothyroid a little bit more deeply, try to figure out what those root causes are that's driving that dysfunction. So this is a graphic that I made depicting different root causes of hair loss. So I made it to help visualize the variety of sources of inflammation that can interrupt the healthy hair growth process directly or indirectly. Because there's virtually endless numbers of root causes of inflammation, I wanted to create a framework that I could use to think critically about my clients' hair loss cases. So, all of these, myriad of different root causes, kind of, we need a better, easier way to think about them. And that's why and how I was able to come up with my functional hair loss types. So there's 4 functional hair loss types: stress, nutritional, hormonal, and inflammatory. So I created this proprietary tool, a matrix, as a way to help clinicians like myself to think about hair loss through a functional whole body lens. So these types are groups of root causes, and they each have their own unique set of key indicators and top laboratory tests that can help us when we work with clients who are experiencing hair loss. So just a word about the functional hair loss types. First of all, they're not a diagnostic tool. So, just because someone is a stressed hair loss type, quote unquote, it's really just a way to help us think critically through a functional whole body lens. It's not, a substitute for a diagnosis. Clients can be and often are more than one of these types. So I don't ever expect somebody to fit neatly into, say, the stress type of functional hair loss. The root causes that the types encompass, it's not an exhaustive list. There are likely many, many root causes that aren't included. These are just ones that I saw most frequently in my clinical practice. The different root causes, the different types, they could have a direct or an indirect impact on the hair growth process. So it isn't my goal to draw a causative line between all the potential root causes and hair loss. And then lastly, as with every client that we work with, not all of their concerns are going to be within our scope of practice. So just being mindful about what your scope of practice is. All right, so let's get into what these functional hair loss types are. What I want to do is just go through each of them one by one, and just spend a little bit of time helping you to understand how you could leverage these in your own practice when working with clients experiencing hair loss. So to start things off, we're going to talk about the hair loss type stress, the functional hair loss type. So this one looks at emotional or mental stress, sleep issues, overtraining, and glycemic dysregulation. That's all what's rolling up into that stress functional hair loss type. So let's look at some key indicators, what you could look for when you're working with clients who could be experiencing this type. So here's a list of key indicators, signs, symptoms that may make you think, I wonder if this person kind of fits into this stress functional hair loss type. So when I think of this type, I think of a client that I worked with who had been really into CrossFit. It was really important part of her life. So she went to her gym. In CrossFit, they call it a box. So she would go to her box 4 to 5 days per week, which is pretty frequent. And then on her quote unquote rest days, she would go for trail runs. So, she was definitely, falling into this overtraining, category. On top of that, she was also on a very low calorie diet per the fitness instructors at her box. So, just kind of furthering that amount of stress that was on her body. So she had been experiencing so many symptoms from this list for a little over a year. So sleep issues, fatigue, brain fog, frequent illness, weight loss resistance, low libido. But it wasn't until she noticed hair loss that she was able to recognize that she was overtraining and was motivated to make a change. So here's some key clinical assessments that can help with this hair loss type. So I use intake forms when working with clients. So I'll ask them about their perceived stress, maybe on a 0 to 10 scale. How stressed out, are you on a daily basis? Their perceived sleep, how do they feel like they're sleeping overall? Are they falling asleep easily, staying asleep all night, waking up feeling refreshed? So I might ask them some 0 to 10 scale questions about that. I'd also want to gather information from the client about their workout intensity and frequency, since this type also encompasses overtraining. And I think for that information to be meaningful, it's wise to familiarize yourself with different types of workouts so that when a client says, for example, I do CrossFit all the time, or I do Orange Theory Fitness all the time, that you would understand that those represent high intensity workouts, or like spin class versus riding, a bike more leisurely. So that can be helpful to really understand the information that your clients are sharing with you. And then I also use something called a symptom survey. So I'll share this with you and show you how useful of a tool this can be. So this is just one small section of my symptom survey. This is the gastrointestinal section. So I send this to clients, and I actually use this with some frequency during the duration that I work with clients. So we'll collect information at the beginning of our time together, and then once a month, every month that we continue working together, so we can quantify, their symptom severity and frequency over the time that we're working together. So the different groups of symptoms that I track, in addition to gastrointestinal, are cardiovascular, hormones, musculoskeletal, respiratory, skin, neurologic, eyes, and hair. And I have clients rank from 0 to 4 based on their symptom severity and frequency. And I think it's a great way to track symptom data and to really paint a clear clinical picture. And using it to track progress over time can be really helpful as well, and increase client adherence to nutritional protocols from my perspective, because if hair regrowth is possible, it can take a long time in order for clients to see decreased shedding and an increase in hair regrowth. And so tracking, other symptoms can be a good way to help clients feel more encouraged, by the work that they're doing with you, and increase their trust and adherence in your protocols. So here's some key lab data for the stress type. This might not be the same lab test that you would order for your, clients that you're working with. Maybe you would try to collect other data, but these are just lab tests that I often find myself using for this type, or data that I'm often looking for this type of functional hair loss. So fasting insulin, which in my experience and based on my research is a more sensitive indicator of blood sugar dysregulation compared to a fasting glucose. So I find that to be a very useful marker. Maybe you also would want to include a glycated hemoglobin with that. Heart rate variability data from a wearable fitness device, not exactly lab data, but important client metrics that would be useful. And I'll talk a little bit more about that in a moment. And then a functional lab that I like to use for this type is called the Dutch Complete. I'm not affiliated with that lab company at all. It's just a test that I enjoy using in my practice. So Dutch is a acronym. So it's Dried Urinary Test for Comprehensive Hormones. And what I like about this test is that it assesses adrenal function pretty comprehensively, looking at both free and metabolized cortisol. And it also, the Dutch Complete measures sex hormones too, progesterone, estrogens, different androgenic hormones. So it's 35 different hormones in total that they test, I believe, and it's a convenient at-home urine test. So I find that to be very useful for a couple of the different functional hair loss types, but especially the stress type. So just a word about heart rate variability, because it's maybe something that a lot of us aren't as familiar with. So when we are in the sympathetic branch of our autonomic nervous system, which we often refer to as fight or flight, it produces faster heartbeats. When we are in the parasympathetic branch, that rest and digest mode, it's associated with slower heart rates. So our ability to move between one and the other, sympathetic and parasympathetic, experiencing different heart rates throughout any given day, is a positive sign of health and resilience. So you're better adapted, to the level of stress that you're under. So what we want is for our clients to have higher heart rate variability, or HRV. So there's different wearable fitness devices that can produce this level of data. Based on my own research, I prefer the Oura Ring. It's another brand that I'm not affiliated with at all, but what I like about them is that they are able to collect heart rate variability data in a way that minimizes external factors that can influence the data. But I'm sure that there are other, high quality wearable fitness devices out there, but just, they can be a little bit of an investment for yourself or your clients. So just make sure that you're doing the research to find out, whether or not you're getting the best quality HRV data. Okay, so the next functional hair loss type is nutritional. So primarily what I'm thinking of when I think of the nutritional type is under eating and then gut health issues, things that would impact our digestion and absorption. So here is the key indicators, when we're thinking about this type. Under eating, I think it's important to remember that that could look differently depending on the client. So it might be chronic dieting, limited calorie diets, intermittent fasting, but it could also be limited or restrictive diets. For example, like an autoimmune paleo diet or low FODMAP, or, if you find that your client is avoiding a large number of foods that they're reactive to, the more restrictive of a diet that our clients are on, the more difficult it's going to be for them to meet their nutritional needs, to meet their caloric needs. But other sources of undereating could be food scarcity. It could be low appetite. And I think it's also important to note that it's important not to make assumptions about your client's food intake based on their weight or BMI. Overweight or obese individuals can also have eating disorders like anorexia. So we'll get into clinical assessments, but I think using a food journal is a good way to assess your client's typical food intake. And when I think about this type, looking at these key indicators, I think of a client that I worked with who was on a very limited diet due to many, many food sensitivities. So when this client started working with me, She actually uploaded a spreadsheet with all of the foods that she could or couldn't eat, and they were color coded: red, yellow, green, red being foods that she would absolutely avoid, yellow being foods that she could tolerate in small amounts, and green being foods that were okay. So her idea before working together was that avoiding reactive foods would solve her severe gut symptoms, although they never did for very long. And in her case, it was severe maldigestion and malabsorption related to gut dysbiosis and hidden gut infections, and a history of restrictive dieting that was contributing to a lot of her chief complaints. So clinical assessment, I noted a food journal. Again, don't make assumptions about whether or not your clients are having adequate food intake just based on how they look. That's really dangerous. Intake forms, the symptom survey that we just talked about, I think could be very helpful to gather information on some of those key indicators that I just shared. And then on their medical history, paying special attention to drugs that can impact the gut, so like proton pump inhibitors or antibiotics. And then if they had any diagnoses related to the gut, for example, like IBD or IBS or celiac, things that could impair digestion and absorption of hair critical nutrients. So here's some key lab data that I find to be useful for this functional hair loss type. A comprehensive metabolic profiled CMP. You might see abnormalities in their electrolytes or their urea or liver enzymes. Serum red blood cell vitamins and minerals can offer some important clinical insights. A lipid panel for clients that have a history of severe undereating. LDL and triglycerides can be low. So lower, not always better when it comes to lipid panel. Organic acid test can be a really helpful way to assess nutrient need, functional nutrient levels. And then GI map, not affiliated with them either, but it's just the functional stool test that I find that I prefer in my practice. But a functional stool test can offer great insights into the level of inflammation in your client's guts, how well they're digesting and absorbing different nutrients, that sort of thing. So that is a pretty key piece of lab data in my experience working with this functional hair loss type. Okay, so a word on proteins and hair growth. So our hair is made up of a protein called keratin, and cysteine is a major component of keratin, and it helps provide strength and rigidity to our strand of hair. Vitamin B6 actually helps support cysteine's incorporation into keratin. And the amino acid lysine supports hair shape and volume and can help with iron and zinc absorption, which is also really important for our hair health. So some real actual, hard-hitting stuff to share with clients about the link between our diet and our hair. Okay, let's talk about the hormonal type, the functional type of hair loss. So for this type, I'm thinking about sex hormone imbalances and about thyroid health. So here's some key indicators. These are, symptoms that I frequently see associated with this functional hair loss type. For this type, I'm thinking about a case that I had where the client's primary complaint other than hair loss was actually dandruff. So when we started digging into her other symptoms, she said that she also had oily, acne-prone skin and hirsutism. So sebum is an oily substance released by special glands on our skin, and hormone imbalances, specifically high androgens, can increase the amount of sebum that gets released. Dandruff is often caused by yeast overgrowth on the scalp, a yeast called Malassezia, and that yeast feeds on sebum. So, kind of picking apart, taking that root cause mindset, looking at those surface level symptoms and going deeper, finding nutritional links to those can be just so helpful and so eye-opening for clients too. So clinical assessment for this type, intake forms, perceived stress and sleep again, asking your clients about a history of overtraining and undereating. When it comes to our hormones, it's not just our current habits that may influence whether or not we're experiencing hormone imbalance. It can be previous habits as well. Late stage adaptation to chronic stress is characterized by low levels of hormones like DHEA. So getting a historical picture is important, since it's not just our current behaviors that can shape the clinical presentation. Symptom survey, again, I just find that really useful. On their medical history, paying special attention to history of pharmaceuticals that can influence hormones, like hormone replacement therapy or hormonal birth control. If they have any diagnosis related to thyroid issues or blood sugar issues, those are things I'm going to be paying special attention to as well. So here's some key lab data for this type. I often find myself requesting a full thyroid panel for these clients. So not just TSH, but free T4 and free T3, just to find out how much of that active thyroid hormone is available to the cells. Reverse T3, and then the autoimmune thyroid markers as well. Fasting insulin, which I'm going to share some really interesting insights with you in a minute about insulin and how that impacts our sex hormone balance. And then the Dutch Complete I really like for this type 2, because not only are you looking at the adrenal function, but again, you're able to assess those different hormone levels in a convenient at-home urine test, which clients really, really like in my practice. So insulin and androgens. High levels of insulin can upregulate the hormone pathways that produce androgens. And high insulin can also suppress the levels of sex hormone binding globulin, which increases the amount of free or bioavailable androgens. So sex hormone binding globulin is a transportation protein. And when a androgen is bound to sex hormone binding globulin, it's basically inactivated. It's not available to, bind to hormone receptors and do hormone-y things, as I like to say. Probably not the correct technical term, but you get my message. So if high levels of insulin suppress levels of that protein, that means that there's less protein-bound hormones, and that there's more free or bioavailable hormones available, which can increase symptoms of high androgens. And then dihydrotestosterone, DHT, that's an androgenic hormone that readily binds to the hormone receptors of hair follicles. So hair follicles have hormone receptors. Testosterone can be converted to DHT by an enzyme that's called 5-alpha reductase. So serum levels versus intracellular levels of DHT can be independent. I think that's a really big deal that not, a lot of people really understand, that, just because we see normal levels of DHT on, a serum test or something like the Dutch test, it doesn't mean that the intracellular levels necessarily have to reflect that. So I think for me, the takeaway is that it just reinforces the importance of taking that root cause approach to understand how insulin, cortisol, low progesterone, those can all increase 5-alpha reductase activity levels. And, so just taking that root cause approach to normalize that enzyme activity in order to normalize what's happening, not just at a serum level, but at a cellular level as well. Okay, so this is the last functional hair loss type. We're going to go through inflammatory next. So when I think of the inflammatory functional hair loss type, it is encompassing autoimmunity, toxins, infections. So this is like a very large umbrella. It's a lot of things, make up the inflammatory type. So let's work our way through this. So this is a very high level key indicator. I'm going to spend time looking at autoimmunity, toxins, and infections one by one, just because they're so disparate. But at a really high level, some key indicators might be low nutrients, especially antioxidants, B vitamins, iron, minerals like copper, magnesium, manganese, selenium, and zinc. Low vitamin D levels, and then nutrients related to the glutathione system. So glutathione levels can be taxed from toxin exposure, but glutathione is also really important for regulatory T cell function in autoimmune diseases. So something that I tend to hone in on. And then gut health concerns, maldigestion and or malabsorption, and then high or low secretory IgA, which you would see on a functional stool test. So autoimmunity, it's important to remember that it's diverse presentation impacting many different systems. And so, so many different things that we wouldn't be able to capture all on one slide. So when I think about autoimmunity and the functional hair loss type inflammatory, it could be a direct impact on the hair growth process, like you would see in alopecia areata. So that's an autoimmune disease that impacts the hair follicles. Essentially, the immune privilege of hair follicle is revoked in alopecia areata. So maybe the autoimmune disease is impacting hair growth directly, like you see there. Maybe it's indirectly, though, like what you might see with like celiac disease or IBD, where you're seeing maldigestion and malabsorption, which is compromising nutrients needed for healthy hair. And then another consideration here is pharmaceuticals that are used to treat autoimmune disease. Just being, mindful, knowledgeable, doing your research, learning about the different, not only drug nutrient interactions as we often do as CNSs, but also looking at the side effects, which may include hair loss. An example is corticosteroids. So prednisone, for example, is frequently used in autoimmune disease, and one of the side effects is hair loss. So toxins, remember, is another part of the inflammatory functional hair loss type. So same thing with the autoimmune, diverse presentation, impacting many, many different systems. It really depends on what is the toxin, what the level and duration of exposure is for our clients, among many other factors. Some toxins that I'm thinking about are mold, which maybe your client presents with fatigue, with fungal infections like thrush or vaginosis, jock itch, athlete's foot. Another type of toxin maybe we'd want to look out for is heavy metals or chemical exposure, which I mean in a really broad sense. So just as an example, a client that I worked with had her home insulated with spray foam. And unfortunately, it wasn't installed correctly. It wasn't cured correctly in time for her and her family to move back in. And so when they moved in, they were exposed to some sort of chemical off gas, and her entire family got severely ill as a result. And she experienced hair loss that persisted for over a year after that exposure. So I have no idea, what that type of toxin, was, but, she was coming to me with a number of symptoms, including hair loss that occurred after that exposure. 50% of homes in the US are estimated to be experiencing dampness and mold. So I mentioned that on the last slide that could be a toxin exposure, and not just spore-based illnesses, but potentially also mycotoxins as well related to mold. So there is a heavy prevalence there. And this survey is looking at homes, and it's important to remember to be mindful of the work environments that your clients are in as well when it comes to toxins. If they're working in a moldy building, or they're exposed to toxins just in their normal line of work, figuring out how that's going to impact them, their nutrient status, I think is really important. So infections. This could be many different things as well, but some that I'm thinking of, might be chronic infections, Lyme disease, looking out for symptoms like joint pain and degeneration, fatigue, depression, anxiety, or other cognitive dysfunction. The Epstein-Barr virus, which is what causes mono, is probably how your clients will refer to it. Key symptoms there: fatigue, fever, swollen lymph nodes, and large spleen. But infections could also be gut infections. So stomach bug. I've worked with a couple of clients who have traveled internationally and experienced a gut infection. Symptoms include abdominal pain and cramps, diarrhea, vomiting, rapid heart rate, low blood pressure, fever, malaise, reactive arthritis. More than 90% of the population is believed to be affected by the Epstein-Barr virus. So pretty high frequency on some of these concerns that could impact the hair growth process, either directly or indirectly. So clinical assessment for the inflammatory functional hair loss type. Health history and diagnoses going to be really relevant here. What does their doctor diagnose them with? History of exposure. Do they have history of living in a water damaged building? And that's whether or not the client has seen the mold, smelled the mold. If there's history of water damage, it's a possibility that there's mold there without them knowing it. And it could be contributing to some of their health issues, and you'd want to make sure that they get the support that they need. History of infection, so an infected tick bite, or mono, or a stomach bug, that sort of thing, capturing that kind of information. History of exposure to toxins, chemical, heavy metal, etc. And then the symptom survey can be a really helpful way to gather useful, clinically relevant information about these clients. So lab data for the inflammatory type. This isn't to say that all of these labs are, going to be necessary in the cases that you support. They're just labs that I've seen, come up in my practice, either ones that I've ordered for clients, or that their, other healthcare providers, primary cares have pursued for them. So complete blood count, the comprehensive metabolic panel, vitamin D, iron panel, kidney tests, inflammatory indicators there, autoimmune markers, Epstein-Barr panel, Lyme panel, a mycotoxin urine test, GI map, which we talked about before, maybe including zonulin, which can be a marker for leaky gut and inflammation coming from the gut there. Fatty acid panel can sometimes be helpful. Organic acid testing, which is a great way to measure nutrients related to that glutathione system that we talked about. I always pay special attention to pyroglutamate too, which can help us understand our clients' glutathione levels. And then a Dutch complete can be helpful as well. And that's it. So thank you so much for listening to this webinar. I hope that you learned a lot, that you were able to gain some little nuggets that are going to help you in your own practice and keep you thinking critically and taking that root cause whole body approach to your cases where clients are experiencing hair loss. You can find blogs on my website, brittreuter.com. If you want to, send me any questions or pick my brain, my email is britt@brittreuter.com. And I'm also very active on Instagram at BrittReuter_CNS. Thank you so much again.